Hi there, I'm David Staples with the Edmonton Journal, and I'm here today with Liane Faulder.
Also with the Edmonton Journal.
Also with the Edmonton Journal. I'm looking down, so I've got the camera up a little higher. So I've been doing this regular feature, top 10 tweets in Alberta and around the world online, and we also do this video component. And I want to say a couple things just heading into it. What I'm trying to do with these tweets is not say any of this stuff is true. That's not the idea that I'm putting my imprimatur like this is the truth. That is not it. I'm trying to kind of sum up the mood of the world. Some of the political debates that are going on from both sides, some of the really crazy talk, some of the interesting talk, what scientists say, what crazy people say. So that's like when we read out a tweet, it's not like me saying, yes, this is true. So I just wanted to say that because people are really hyper right now. That's what I find.
I think that, trying to sum up the emotions and the feelings of the world is ambitious. And I applaud
It is
you.
ambitious.
I applaud you for it. Because all I'm doing sitting here is thinking, my nose is itchy. My nose is itchy. I can't scratch my nose, but I'm just going to scratch it. Oh, there we go.
I'm going to have to report you.
Feels so much better.
You're done. You're done in this country. Canceled. COVID canceled. All right.
I'm ready.
All right. So we're going to start reading this tweets. And Liane, why don't you go first?
Okay.
Was that the plan?
Well, yes. Of course that was the plan. And if it wasn't, we will never acknowledge that. Okay. This one is from Gary Dimmock, and his Twitter handle is @CrimeGarden. Just in. Ottawa residents told to stop having beers in driveway and to end pleasantries with neighbors over the fence.
This is a tweet from Emily Simpson of the Real Housewives of Orange County, and it comes under the hashtag of quarantine life, which a lot of people are tweeting about their lives under quarantine. So here's what Emily Simpson has to say. Quote, I ate a whole apple pie yesterday. That's it. That's the tweet.
I don't even believe it, for one thing. Speaking to your previous reference of this is not necessarily the truth, because a whole pie for one of those housewives, there's no way they do that. They're too thin.
Have you seen some of them, Liane? They're not all tiny, is what I'm saying.
Okay.
Politely saying. Okay.
All right.
I believe it. Okay.
Okay, good. Therapist and writer Philippa Perry, who tweets under @Philippa_Perry. What have you learned about yourself in lockdown? I realized that 1, I was just buying clothes because I was addicted to buying clothes. 2, I used to take pret-a-manger completely for granted. And 3, I like being with other people even if I don't know them all that well.
Must be an extrovert.
Mm-hmm. Mm-hmm.
This must be brutal for extroverted people, like super extroverts.
Yeah.
All right. Here's a more serious one. This is from this is in the category of you think we have it bad in Canada. This is Indian Muslim socialist. That's how he identifies himself on Twitter. MD Asif Khan, and he tweets, quote, separate hospital wards for Hindu and Muslim in Modi's Gujarat. I think that's a province. India is the only country where COVID-19 patients are separated based on their religion. All this happening because media and society is falsely accusing Muslims of spreading the virus. And I've been following the Twitter feeds from India, and there's all kinds of sectarian strife in that country and accusations back and forth. So
yeah,
we have political strife on a kind of a moderate level here, but at least conservatives and liberals still go to the same hospitals.
Yeah, definitely. I mean, there's a lot of divisiveness, large and small around COVID-19, but you are right. We are blessed not to have issues of quite that size and dimension here. Definitely. My next tweet comes from Maclean's writer, Jason Markusoff, who tweets at @Markusoff for the West. Briefly, of the 138 positive COVID tests in the last day in Alberta, 128 were in the Calgary area. And so I know that the Premier has said they're going to be having a look at those patterns and trying to figure out why that is happening.
Yeah, I wonder what it is. Travel, like more people, international travelers there, possibly. Mm-hmm. Maybe it just got into their seniors' homes quicker. Could just be really bad luck. Mm-hmm. My next tweet comes. It's about the kind of the Canadian disputes that are going on. This is from digital public affairs consultant Stephen Taylor, and he says, "Quote: I have strong opinions about Andrew Scheer putting his family on a plane and Justin Trudeau visiting his family at a cottage Because I am a lunatic.
I like that one. And I like your delivery. Respect that. Good work.
I do the lunatic well, Liane, unfortunately.
You said that, not me.
Well,
Okay.
I beat the punch.
So
All right.
Sam M. Ewington, who tweets under @WingsItWell, has this to say. 1. Even with all this time, I am still incapable of putting clean laundry straight away. 2, I will literally watch any program if it's based on real life events. And 3, my hair, when not straightened in 2 weeks, does not resemble sexy bed hair, but does resemble that of a woman left for dead. And as a woman who has some issues around volume of hair and frizziness, I so related that left for dead.
Yeah, hair salons are essential service. Just kidding. Former commissioner of the U.S. Food and Drug Agency, Scott Gottlieb, who was one of the people, who took this whole thing very, very seriously in January, so way ahead of the world. He says, quote, if new COVID-19 cases continue to decline through April and May, we'll see states advance responsible plans to gradually bring people back to work in May and June in staged fashion with close eye on testing and safeguards to make sure that spread doesn't spark.
What do you think of that? He's a kind of a visionary, or at least he was ahead of the curve.
This is exactly what responsible people should be doing right now. They should be saying, what are the markers? What do we have to see in terms of the spread of this disease and the impact on our hospitals in order to reopen society? I mean, the job loss here is already, it's appalling, but it's going to set in and people are going to start to go, they're going to, the anxiety, the fear, the economic suffering here is going to be intense if we don't get on this and figure out plans, how to move forward safely. And other countries have done that already.
Yeah.
And there's going to be starvation, Liane, in other parts of the world. They're already talking about it in Africa and India. There's been fears about that. So it's not just this small problem of, rubbing out the disease in, getting the case count down. There's all kinds of other stats that we're going to have to think about, like, unemployment stats, starvation stats in other countries. So that's what I think about it. Like, let's get moving.
I think in order to keep people engaged in the conversation too, you have to give them some sense that it is going to end, and it's going to end in a clear and carefully planned way. But there can't be on the horizon an endless COVID lockdown. People, I think at a certain point, they just won't be cooperating with it anymore if they don't see some sign that a plan is in place to return to some semblance of normal.
Yeah, I think we need to see the spread contained, and then when we open up things again, we'll say, okay, here's the level of containment that we need, whatever that is, percentage of the population that has it at any one time. And if we go above that, we have to start shutting things down again.
Yeah.
And we also have to look at hospitalization and ICU beds. What percentage of those are set aside for patients, and what percentage of them are full or not? And if they're not full, if there's not a lot of cases, well, then you can open things up, keep them open. And if we don't start really challenging our hospital system, then we just keep going. I think that's the way through this. But again, I'm not an expert. I'm just reading a lot of experts and trying to make sense of how we have to proceed. But I think, like, we're all in this battle, like every single one of us.
There's no one unaffected.
We all have to get involved and engage in the discussion, because the government needs us to support them or not, probably to support their plan, whatever they come up with. They're going to need a certain level. They're going to need huge buy-in, actually, and they're going to need support from us. So we need to get informed. So as we're making this plan, there's a really healthy discussion around it.
And I think here in Alberta, we're quite lucky because we've had some really good responses from our public officials. We've been touted for having, a pretty good plan in place to distribute medical equipment, gloves and masks and all that kind of thing. We've had a great deal of support for Dr. Dina Hinshaw, I think people are willing and able and want to listen to our officials because they are, generally speaking, doing a pretty good job, and that's going to hold us in good stead as we go forward.
The confidence that Hinshaw has inspired has been kind of like the story in Alberta on a certain level. It's been awesome to behold. But other than that, like the work that J.P. Prasad did in the medical procurement, they were doubling their orders in December, Liane. They heard rumors in December and they doubled their orders. And then in early January, they made a huge, tens of millions of dollars order of medical equipment before other countries, other places were acting. I mean, I'm not going to get into my critique of other jurisdictions, but Alberta has been, it's been inspiring actually.
It has inspired confidence. Yeah, that is for sure.
Our public service in action. And all right, what's your next tweet?
Well, this is the last one, is it not?
Yes, it is.
4, and this is the 5th. So this one comes from The Guardian, one of my favorite news sources, and it's @Guardian is the Twitter handle. And here is the story. New Zealand Prime Minister Jacinda Ardern and ministers take a 20% pay cut in solidarity with those hit by COVID-19. And I just raised this one because I think Jacinda Ardern is a superhero. She's very lucky in that she has just a great ability to appear like really in charge and tough while also being very empathetic. So, New Zealand has some of the toughest, most buttoned down restrictions and so on anywhere. People aren't going to be flying to New Zealand for the next year. There's a complete lockdown for that time, at least at this point. But at the same time, she sort of had the wherewithal to declare the Easter Bunny an essential service. So she is blessed with that ability to look really firm and also empathetic. So I think she's a rock star, and I just wanted to reflect on that.
She was the first, like after she did the Easter Bunny thing, almost every other world leader did the same thing. So she's a leader in many ways in this crisis, Liane. And, her 20% pay cut from a public servant is an interesting gesture. And kind of
wonderful to see people leaping on that as an example they want to follow. It's a lot harder to get business.
Well, would you leap on it? This is the thing. Like, I don't know if I want to endorse it, Liane. Like if someone came, let's be honest. If someone came to you and said, "Okay, 20% pay cut," or me, what would I say? So I'm not going to say. I think it's really good she did that. If she's a public servant, if she's going to do that, and especially if people are really suffering, obviously, and all kinds of economic woe happening, but. If I'm completely honest, if someone said that to me, I'd be.
Oh. I wouldn't be keen. No, and that's all I'm saying about that.
Yeah. So good for her.
Yeah, look over here. Look over here. Look over here.
Look over there.
Shiny.
Yeah, we like her. We like what she did. But.
And what was your final tweet?
My final one is from Globe and Mail correspondent Eric Reguli, who's in their correspondent in Rome, and he said, his is a headline, and it's "Woman fined for taking turtle for a walk in Rome."
I love those Italians. Like when they make up their minds, they just go hard. He had another piece that he wrote about in the Globe and Mail, in which he said that people were out walking, and when they were stopped by the police, they told the police they were exercising, and the police said, no, running is exercise. Walking is not get home, go home. So, yeah.
Yeah, well, when you have a lot of deaths in a place, when you have that amount of death, it really changes people get really, really strict and draconian. And, we all know that turtles are super spreaders. So,
God, for a minute, I thought, I hadn't heard that.
They're much worse than hares.
Just for a second.
They just go slowly everywhere, spreading the virus.
And speaking moistly.
So, yeah, there you go. I don't know. I hope. There's this debate in Alberta about golf courses. I'm not a golfer, but I would hope. And that by the time golf courses are ready to open here, that we figure out a way that people can get outside, and in things like that, where you're essentially going for a walk with a stick and a ball in your hand,
Yeah.
that we can figure out a way to make these things happen.
Yeah.
And I think the time in a couple of weeks, the way the trends are going here in Alberta, maybe that will happen. That's what I hope. I mean, it's a big issue now, but people, we've got to get outside.
Yeah, yeah,
And
it's very, very poor for mental health to be trapped inside too much. And, particularly there was a time when Dr. Hinshaw was saying that people who are in isolation, could not leave their property, which is fine if you have a backyard. But, for people and for children who live in apartments and so on, I think some of those things are just untenable. And I would like to see that kind of stuff be loosened where appropriate, because people have to be outside and children have to be outside.
oh, yeah, my parents are in their 80s. They're in a seniors lodge in total lockdown. They can't
Yep.
see us. We can't see them. They're stuck in
Same
their.
with my parents. Yeah.
I've been waiting all winter for it to take them out. Like
Hmm.
to like they've been like the best time they had last summer was when we would take them to the Botanic Gardens out by Devon. They'd finally get out of out of the lodge, get out, see the world. Like, and to think like they're the most vulnerable people of all going forward. And to think that we couldn't maybe do that this summer.
That would be really hard. Yeah.
Like,
Yeah.
yeah, that would be really hard. And
Yeah.
I don't know what they would pick. So ultimately, but they might not even have the choice, because if there's a lockdown, there's a lockdown. You can't, if you
Hmm.
leave, you can't come back. I don't think so. This is brutal.
Yeah,
This is brutal.
it is. Yeah, it is.
Alrighty.
All
Thanks,
right. Well, thank you very much for inviting me. That was fun.
thanks, Leanne, and I hope to have you back.
We'll do it again.
Okay, thanks a
Bye
lot.
for now.
Thanks everyone for listening.